Okay. So we are starting on our sheet over here on the left-hand side. So we're leaving the heart. And like I said, arteries, we're talking about systemic circuit. So they're systemically, they're going to be red because it's oxygenated. If we were talking about the pulmonary circuit, then they would be blue because that's deoxygenated. But that term artery just means it's going away. Okay, so leaving the heart. So we're going to kind of talk more about the systemic circuit. So they're under the highest pressure. So you see the aorta is right here. And you can see the difference between systole and diastole. So you see there's a difference in pressure. So only in an artery is there a pulse. And so I put that over there. So that's where you can take and feel a pulse, and also where you measure blood pressure. There are 3 types of exiting or efferent vessels, so arteries. Have to cough, excuse me. The first are the largest. They're the elastic arteries, and they're called elastic arteries. Take a stab at it. They're elastic. Okay, yep, don't make this harder than it needs to be. Since they're under the greatest pressure, they are the ones closest to the heart. So think the big branches, right? So the aorta, the brachiocephalic, the subclavians. Even too in the abdominal cavity, we're going to learn the abdominal aorta is going to branch into the common iliac. So just the really large vessels closest to the heart, they are under the highest pressure, so they have the most elastic fibers. The next ones are called muscular arteries, and sometimes they're also called distributing arteries. These are the ones that are going to get names like splenic artery, renal artery, they'll tell you where they're going. So a lot of those are the ones on the lab list. They are further away from the heart, so we're going to have, they still have some elastic tissue because they're still under pulse pressure, but they're going to have less. So the biggest tunic layer that they have are muscles, so that tunica media, so they're called muscular arteries. Then they're going to branch and they're going to get smaller, and that just IOLE at the end of anything just means it's smaller, just a little arteriole. These, we're going to get a drop in blood pressure because there's lots of them and we have increased resistance. And so they're going to be the most important in controlling blood pressure. And so they're the on-ramps to the capillary beds, so arterioles. So those elastic arteries, you see those blue fibers are in all 3 tunics. They are, like I said, they're going to expand when the heart beats, so is ejecting blood, so systole. And then when the heart is resting, they're going to recoil, and they are what's responsible for that diastolic pressure. So that pressure in the vessels, when the heart is at rest, blood is still moving because of these elastic fibers. Even though they're muscular, they are not going to be the muscles. When I start talking about blood pressure and vasoconstriction and vasodilation, they are just have their muscles so they don't burst. Okay, they just have their muscle to resist that pressure inside of the vessel. So they're inactive in vasoconstriction. Functionally, like I said, they're pressure reservoirs. That recoil is going to provide that pressure, that lower number in the blood pressure reading. When the heart is at rest, we still want blood to move. So that's diastolic pressure. The next arteries are called muscular arteries. They have a thick tunica media, so they have more smooth muscle and less elastic tissue. So they're going to be smaller in diameter than the elastic arteries because we're branching. And like I said, they're called distributing because they're actually going to go places that have recognizable names to you. So splenic and renal and brachial and femoral. When we get down, now we're smaller. There's going to be more of them. So now we're branching and we're going to the neighborhoods, if you want to think about it that way. Arterioles are going to have the smallest diameter of all the arteries, about like 300 micrometers, 0.3 of a millimeter if that helps you. They have sphincters. Remember, sphincters are circular muscles that when they're contracted, they're closed. Right? And then when they are relaxed, they're open. So they can control blood flow going into the capillaries. So functionally, they feed into capillary beds. The arterioles, too, because they do have a thin tunica media, they're going to be most active in vasoconstriction and vasodilation. This is how we control our blood pressure short term. Okay, so I'll connect it to blood pressure on Monday, but this is a control blood pressure, arterioles. All vessels, because we're going to use that tunica media and that lumen size, so the diameter of the vessel, to control our blood pressure. Because we want control in all situations, there's always some tone or some partial constriction to the vessels, right? So this is kind of showing you normal cross-section. That way, through autonomic control, the middle layer, the smooth muscle layer, can constrict, and that's going to raise blood pressure, or it can dilate to lower blood pressure. So there's always some amount of tone going to the vessels. This is going to be sympathetic nerve fibers. Short term, it's parasympathetic for sexual arousal. We'll hit it in Unit 5. So sympathetic nervous system causes vasoconstriction, increased blood pressure. No sympathetic innervation, then we get vasodilation and blood pressure goes down. And if you're kind of having trouble understanding this, hopefully you've played with a hose, right? So if you want to shoot somebody across the room, you put your thumb over it. So vasoconstriction increases blood pressure, right? If you take your thumb off, that's like a big, nice lumen, so vasodilation lowers it.
What is SMS?
Sympathetic nervous system. So that's your fight or flight autonomic branch. So we have elastic arteries, muscular arteries, arterioles. This, what you're looking at, so this right here, this network is a capillary bed. And we said capillaries are the functional unit of the cardiovascular system. Those are the vessels where we're going to get exchanged, right? So drop off nutrients, oxygen, pickup of waste. All of our tissues are not always doing anything. Like right now you're sitting here in class. The muscles of your legs aren't doing a lot, okay? So they aren't using a lot of oxygen. They're not using up nutrients, and they're not generating waste. So what the cardiovascular system is going to do is tissue that doesn't need delivery or pickup, it will bypass those. You actually don't have enough blood to fill up all your vessels at once. Oh, I know, disappointing, isn't it? But you're still here, so it's okay. So what the cardiovascular system does is it has these bypasses. So notice, see these sphincters, sorry I'm on the side. So this is arterial side, so coming from the heart. These sphincters are closed, so blood will just go through, so from the arterial side, through the capillary, bypass it, and go to the venular side, and then back to the heart. So it's bypassing that tissue. These are true capillaries. This they call a metarteriole. So true capillaries, like I said, that's going to be our exchange unit. What's going through here, this is not a capillary. So this is a metarteriole. Sorry, so this picture is showing you a capillary bed with perfusion. So perfusion is blood delivery, and perfusion to a tissue is measured as the millimeters of blood per minute that feed a gram of tissue. Am I going to ask you that? No, but do you know perfusion means blood flow going to the tissue? Yes? Okay. This control of whether a capillary bed gets perfusion or not is through the opening and closing of these sphincters. Okay, and that is under autonomic control. So vasomotion is what it's called. And like I said, all sphincters can't be open at once. You don't have enough blood to fill all your vessels, and so they cycle. Okay, so like they'll just sort of cycle like, this sphincter is just going to close for a while and then it opens. And it closes and it opens. And it's going to be based on tissue needs. So autoregulation, so this tissue is being perfused, so there's high perfusion, and that is caused by the sphincters being open because oxygen is low, carbon dioxide is high, that's our waste gas. Also metabolizing tissues create acid, and cells don't like acid, we like to be right 7.4, and also nutrients are being used up. So active tissue gets perfusion. The opposite is also true. So tissues that aren't doing anything don't get perfusion. Okay, so the precapillary sphincters at the end of the arterioles will be closed, and the blood will flow through the metarteriole and just bypass that. There's also something called an arteriovenous anastomosis, and we learned that word anastomosis when we talked about the coronary blood supply. So there's just another vessel to take blood to the same place. Okay, so blood can go from here through the capillary bed and get over here to this venule, or it could just travel through this anastomosis.